Hello.
Dr. Ahmad,
How are you, John?
very happy today. Thank you so much for taking the time.
Of
I
course.
appreciate it big time. How's the family today? Was the family okay?
Yeah, it could have been better.
Sorry.
Okay.
I apologize for that.
It actually it ties perfectly into what we're going to be talking about, the impact of the pandemic.
Fantastic. Here's what I wanted to let you know, though. We are, I was gonna have the unveiling in May, but UH is being very responsive to this. So I don't want to force my art students to have to, create things in the last minute. So we'll have the unveiling this fall.
Okay. I mean, listen, there's no rush.
Well, I just want to let you know that, so that we'll have the unveiling this fall, most likely. I'll keep you up to date on that, because I want to make sure that the art students have enough time to feel it and think it and live it and everything else before they create it. So, because it's a big deal to them, it's a big deal to you, and I want to make sure you have enough time. So,
Yeah.
So how'd you get? First of all, give me your title real quick if you could.
I am a child psychiatrist
At UH.
at UH. Yeah.
And you've been there for how many years?
Well, I've been at UH total since 2012. I did my residency and training here, and I've been on staff as a independent, attending faculty member since 2018.
Fantastic! Wow. When you were a kid, what did you want to be?
Oh, I wanted to be a whale trainer.
That's a new one.
And an airplane pilot.
That's a new one. I never heard that one before.
My dream was. I wanted to be a whale trainer. Okay, so being a doctor was always in the background. I mean, that was just always there.
Right.
But on the days that I could dream, I wanted to be a whale trainer, and I wanted to be a pilot, and I wanted to have my own plane with a whale tank in it. And that was obviously before all the bad stuff about SeaWorld came out,
right,
and all of that. And I really liked music, so I thought okay, maybe I could be a DJ too.
So were there third grade pictures that you drew of a plane with a whale in it?
Yeah, pretty much.
That's fantastic. That's fantastic. Okay, so so you were there long enough time to understand pre and post pandemic.
Yeah, absolutely.
So walk me through, if you can, the changeover between what your regular work day used to be before March 17, 2020, and then after that.
So I work primarily in the hospital, meaning I see patients that are admitted to the hospital. And so, I think in some ways it didn't change for me because I was still coming in to see patients face to face. Obviously, there was in the very beginning, initially, there was that heightened sense of risk. And, every patient room you went into, it was, oh my gosh, what am I going to expose? What am I exposing myself to, or the people I love to, or what am I exposing patients to? Initially when walking around the hospital, it was pin silent. It was so quiet because they had significantly cut down operations. Non-essential procedures weren't happening. People were working from home when they could. They had cut down visitors. There were no visitors at all. And it was, in some ways, it was peaceful. I could finally, I could think. Obviously had to don PPE and wearing masks and all of that was a big change. But, people stopped talking to each other because it was kind of scary. You could just stop by a water cooler and be like, hey, what's up? Or let's go get a cup of coffee. So that was a big change. I think also, working in mental health, obviously mental health was a problem before, but I think the pandemic just highlighted some of the challenges and the gaps in treatment. And I work with kids, so kids weren't doing well overall.
And how are the parents handling this? Because you're dealing with kids, you're dealing with parents too, correct?
Yeah, mostly not well. I mean, I think some of the parents had things going on before, and those that were struggling with their own mental health issues or their own social stressors were having a harder time parenting their children who were also struggling. What I've noticed over the course of pre-pandemic and post-pandemic is just people have just gotten meaner.
Wow.
They forgot how to communicate. They've forgotten how to be kind and nice. And I feel like I have also, as a healthcare professional, I've been subject to more verbal abuse, if you want to call it that. I personally would call it that, but maybe not everyone would, but just more unhappiness, more like disrespectful talk, just more anger from family than perhaps was occurring before the pandemic.
Did your caseload go up?
Initially, our hospital unit, the census went down. I think a lot of people were afraid to come to the hospital. So for a couple of months, it was quieter than usual. But then, as soon as there was definitely a point where it started to pick back up, and it was never ending. And I know that my colleagues in the outpatient settings also felt that as well.
Like, it went from what to what as far as caseload is concerned?
Just maybe not even just the number, but the acuity, in terms of how ill patients were.
Okay.
On the patient side, it was we were always full, and there were people waiting for bed, and there was just never enough resources to get people the help that they needed. And even if we could help them in the hospital, a lot of the services and resources that were in the community weren't functioning at full capacity because of the pandemic. And we saw a lot of people come in because their treatments outside of the hospital had stopped. And so obviously they weren't doing well. And then, they got to the point where they needed hospitalization.
So they would have been fine. They would have been outpatient people. Just getting their meds and their treatment have been fine, but they couldn't get that. So then it became worse, and they had become admitted. Wow.
Yeah.
Never thought about that. Do you have any? I don't want any specifics or anything, but do you have any examples of you say getting worse? Because my son was diagnosed with bipolar back in 2008, and so I lived through that whole thing with him being in the psych ward and being admitted to a couple different institutions before he got himself straightened out. Now he's excellent. He's a teacher of the year down in Florida for geometry, and he's doing fantastic.
That's
but
great.
I know there was times there where I wouldn't know what was going to happen. You're going to lose your son. So tell me, if you can, what your patients went through that the pandemic seemed to make worse for them.
There was a lot of social isolation, people not getting, kids not necessarily getting to socialize in appropriate ways and healthy ways. They were also at home stuck with potentially, dangerous or unsafe or, mentally distressing social situations. So they may have been stuck in situations where domestic violence was happening on a regular basis, or their parents were using substances and they didn't have the outlet of school, or they didn't have, someone at school that was catching this, or identifying the red flags to get them help sooner.
Wait a minute. So I didn't think about that. So that if the parents were used to either using or screaming at each other or fighting or whatever, their routine that they had was hidden during school days because the kid went to school. So not only did they not have to face that, but they had a much more positive setting.
Right.
And something that's gone. Now the positive is gone and they're thrown into the negative.
And then, kids and then they were using social media to socialize. And you and I both know that there's positive and negative impact of social media. And a lot of kids were getting drawn into the negative part of social media. And so we saw a lot of unhealthy coping mechanisms like cutting and food restriction and purging and, engaging in self-harming behaviors. We saw a lot of increase in that. We saw just a lot of parent-child conflict and tense social situations at home. We saw a lot of substance use in kids, and a lot of kids coming to the hospital for aggression or behavior issues related to substance use. And this was at a level that I had never seen before. I mean, when I was a fellow back in 2015, I would maybe see, psychosis every, once every couple, 3 or 4 months. And now it was like, I'm seeing it once every 2 or 3 weeks.
Wow.
And it was a lot harder to treat. And yeah, it was exhausting. And it was at times very demoralizing.
Wow. It'd have to be. Because there's no end.
Right.
I mean, especially if you're in the middle of it in 2020, there's no end that you're hearing if that something's gonna happen soon, especially if we're putting off the vaccine or anything like that. And of course, you're hearing all kinds of stuff they're hearing all kinds of stuff not from people, but from a machine. Now, and whether you believe it or not, the internet's gonna tell you all kinds of crazy stuff it's gonna believe because you don't have anybody else telling you that's not true.
Right.
Wow. Did you know, I've asked coroners this many questions, and they've always said that the number of suicides decreased according to what they have seen, but the overdoses went up at the time of the stimulus checks when they went up. What have you seen in terms of suicide attempts? Because they're not going to see attempts, they're only going to see suicide, so they don't know that, but you would see suicide attempts.
Yeah, I think we definitely saw a rise in suicide attempts, and I think the data nationally has supported that in adolescents, that suicide attempts increased.
Wow. That's something I have not heard before.
Yeah, it's been an intense couple of years, and the challenge that we're facing now is that there remains a shortage of resources for these patients, and there's just not enough mental health professionals in the workforce, and for a variety of reasons. I think one is compensation and pay and appreciation for the services that are being provided. Two is just like burnout, and even the people that are in it are leaving early because of burnout.
And then it makes it even worse. And now you're having less people treating more people.
Yeah.
Wow.
At the same time, I don't want it to all be doom and gloom, but I think in the beginning there was this sense that like we're all in it together, right?
Right.
And I do think that we felt that within the hospital setting for several months. And I think, the longer it wore on, the harder it became, especially like, when the vaccines came out and discussing like, taking precautions. And there came a point where people, I think, were just like fed up with quarantine and, being told what to do.
Describe to me your best month and your worst month in any order you want. Between March 17, 2020 and today.
Honestly, I would have to say the best month was probably April of 2020.
Tell me why.
I know that's odd because it's like, wait, it had just started, but like I said, at the beginning, there was a sense that we're all in this together. We were trying to like make the most of a like really difficult situation. As stressful as it was to come into the hospital, I felt like I had a purpose. I felt like, okay, I'm making a difference. I'm doing something during a very crucial time that other people aren't necessarily able to do.
Right.
And like, the hospital was quieter, there wasn't as much noise. People, were generally getting along and doing what they needed to do, and to support each other and to help each other. The worst month ever is probably a hard question to answer because I just feel like the last couple of months have all been the worst month ever. It just keeps, I think, the stress and the toxicity of like the work just keeps building.
How many of them wanted to go back to school and how many did not want to go back to school?
There was a fair amount. I'd say probably like 60-40 did not want to go back to school. And some people just never went back and they just got sort of lost.
Yeah, I wonder what the dropout rate would be is in that, right there.
Yeah.
Wow. Never thought about that. You'd have a huge spike if you're looking at 75 years of data. You'd have a huge spike in 2021, 2022, and 2020 in terms of dropout rates, I would think. maybe,
Right.
if they track them. I don't know. As far as when you're looking at your worst month, are the holidays usually the worst for adolescents?
Not generally, at least like the Thanksgiving and Christmas holidays tend to be a little bit quieter and better.
Really?
Yeah. I don't know what it is. You know, I think sometimes we find that that's the opposite with adults.
Yeah.
But historically speaking, at least in the hospital, it's been quieter.
When the vaccination came out, and then let's say last summer, things began to be a little bit better, let's just say, in summer 2021. How did your caseload look? Was there a lapse between when things get better on a visual scale from someone like me versus your caseload, or no?
Yeah, I think, you know, what's interesting is the summer also tends to be a quieter time for adolescents because school is out, so that big stress is not there.
Mm-hmm.
And so it was a better time. I will say that, like, I thought that this year with the weather getting better, like it would get better, but it doesn't seem to be. But then we're also facing like school exam time, so
Yeah.
that's a major stressor.
How when you're dealing with this kind of situation with adolescents, how do you tell the parents that they may be the cause of it, or how do they respond to that? I know how I responded to my son. I know how I responded to him, but that's a different. I look upon his bipolarity as truly a medical issue.
Right. Right. I mean, with bipolar disorder, obviously it can be exacerbated by stress, but right. I mean, there's definitely biological underpinnings there, right? Neurochemical underpinnings. With, you know, sometimes it's hard to do when you don't see when you don't have a long-standing relationship with a patient. I think it's a lot easier to do when it's someone that you're working with on an ongoing basis. It's stressful because, you know, you want to be sensitive to the needs of the parent or the caregiver, but you also want them to understand that some of what is happening is not something that is immediately fixable in the hospital or by medications. And that until like their environment changes or something in their environment changes or how their environment is reacting to them changes, they might not get better.
Do any of them suggest that this disorder, they'll call it, is hereditary and that it came from the other parent?
All the time, especially when there's a contentious divorce.
Okay, I thought so. They got to blame something, and it can't be the environment. It can't be them.
Correct.
And so it's got to be something else. Something that they can tell their friends about. Mm-hmm. My child has a problem not because of me or the environment, because of their spouse's traits.
Right. And you know, there's a variety of different reasons for that. I mean, no one wants to believe that they're responsible for their child's illness or that they're contributing to it. I think it then becomes like if it was their problem, it would be harder to treat, right? Like, mm-hmm. Let's blame someone else.
How did you see when you? Here's what my view when I talked about this a little before. I think was when you have people who already had challenges mentally, whatever they may be, and then you take away their routine, take away what they use to make them happy, or whatever environment they can create to deal with the bad. And then they're told by government agencies they have to do this and this and this. How close to the edge does it push people? Because I mean, I saw it, you know, on the news all the time.
Yeah,
but I never dealt with it.
Right, you see it like on the airlines, you know, people becoming violent. I don't know that I necessarily had to deal with that directly in the hospital per se, because I think for the most part, people were following hospital guidelines. There were some that didn't. I think that, you know, it was just, it's challenging because, you know, like certainly mental illness can impact your behavior and your tolerance, right, to stress. Mm-hmm. But it's like not, I always tell people it's not an excuse for bad behavior.
I agree.
Like having bipolar disorder doesn't excuse you unless you're in the midst of a manic episode, right? But just having a diagnosis of bipolar disorder doesn't mean that you have like a carte blanche to go around punching people.
I agree. And I try telling it to my, you know, I was the one, when it came to my son, I was the one that realized that I had it. I never thought about it, but I realized all the things that I created, all the things that I've done in my life came out of bipolar moments. But I had older sisters as a growing up. I had older sisters that would beat me up, so it all kept me in my place. So I was never allowed to get manic. So I always had to worry about, if I say this, who's going to say what? You know what I mean? So I learned self-control and to analyze before I went off and did something, because I know what's going to happen if I did. I would be, you know, I get beat up and punished, and then my parents would find out about it. So I understood that from my son's point of view, that I had it in me. What was your scariest month, and what was your most grateful month?
I think, wow, it's a good question. I think the scariest month was when the numbers started to go up in Ohio, and you started to like really see the impact locally. Mm-hmm. And the numbers just kept trending up. I don't remember what month it was, but you know, before the vaccine.
It was like fall of 20, I think.
Yeah. I think that what was the other part of the question?
Most grateful month.
Ooh. I think that was April in the beginning, because it was like, okay, we're the state and the institution, we're taking the steps that we need to take. Like you had time to sit back and reflect on things. You didn't have any other obligations. You were thinking about like more meaningful things. And I just realized how grateful I was, you know, to have my health, to have my family, to have the resources that I needed in order to get through the pandemic.
That, and I hope that you took it as a positive way, that you being a first responder were being recognized throughout the country and throughout the world, mm-hmm. I think. Because that's a big deal. I mean, that's one reason why I started this project, because I wanted to recognize you guys, because you did tremendous things. I just, you know, mm-hmm. taught through Zoom, who cares? But right. You guys did tremendous things, and you doubled it every day in the beginning when we had the big unknown. And I think that, I think before it became somewhat political, that everyone was bonding together and everyone was, you know, trying to support you and everything that you guys were doing. And then we all got kind of tired of it, some come the fall.
Yeah.
And it's amazing to me how, you know, if you ever wanted to study that, how long does it take to push a race before they begin to get, mm-hmm. before they change their behavior, you know, internationally. The thing about this one was you couldn't escape it, and it's hard to blame any one person or any one entity, because it was everywhere.
Yeah.
And you couldn't just escape it, and you couldn't point your fingers at something because it was invisible. Right. So it was hard for people to understand that, I think. What would you like to have people, from people who look at your artwork, what would you want to have them walk away with? What feeling would you like them to walk away with?
That there was a lot of everything in those moments. There was fear, there was anger, there was sadness, there was frustration, there was exhaustion, but then there was also hope and gratefulness and a feeling of like being in a team and at times not being alone.
Could you share a success story? Either avoiding a negative or a positive thing happen to your patients.
You know, it's so hard to identify one positive situation, but I think that at the end of the day, there were many patients that left being in a better place than they were when they came in. And the best outcome to me is where the patient and the family and the team all were in agreement that the patient was doing better. And, you know, the days where I felt like I was doing my job and where this is where I was meant to be were the days where I got the feedback from families, like, we really appreciate what you did. You know, this hospitalization has really helped our child. And where there was this genuine sense of appreciation and just recognition for what we were doing. Obviously, like, recognition and appreciation is not the reason we went into medicine, but I think in a society where everything has been so negative for a while, and there are so many people that were being, you know, demoralized, that even like one word of appreciation, I think, made a big difference.
I'm glad that happened for you. Not often enough, most likely, but I'm glad it happened. If you'd like, please pass this opportunity along to parents of your patients.
Sure.
And if you interviewed them and just sent me the interview, that'd be fine too. We recorded it. I don't care. I'd rather have you do it because you're the licensed person. I'm not.
Okay.
You know what questions to answer. You know what questions to ask. You know what things will trigger what. But we'd love to hear their story, because I think that this is when you've gone through an international historical incident, which this is. It's, you know, when we're in the middle of it, you don't think about it, but when looking at it from a historical perspective, it's a big deal. And we love to hear their story and provide them with a historical marker, meaning the artwork, for it. So we got time. I mean, I said I put this off until the fall in terms of the unveiling, so we'll have a lot more time to get some stories out there. But just pass it along and see what they think, okay? And contact me anytime. I'm available.
Okay, thank you so much.
Dr. Ahmad, thank you for the stories.
Of course.
Thank you for your perspective. This is such a big deal.
No, thank you for allowing me to share the story.
I look forward to having, I mean, I don't pick the students, the art teachers do it because they know their students, but I know that this is the kind of stuff they would love to hear. I've given everybody a wide variety because, you know, art students are like the public, you know, some people can handle, some people can't. But I want them all to know, I want the students to know, and they all know this, the impact that their artwork makes. It's a big deal to them. So, okay. We will be in touch. I'll let you know what the date happens, sometime in this fall. And you get to meet the artist at the same time. But anybody along the way that you run into, that you want to talk to and share their story, we'll glad to do it.
Okay, thank you.
Thanks so much.
Okay.
Bye-bye.